everyone, welcome to my teaching channel. In today's lesson, we will learn some common terminologies about a few medical equipment used to check a person's health status. So when you feel unwell and you go to hospital or clinic to see a doctor, the doctor or nurses normally use this equipment to do a health check for you and to find out whether you have any health problem. All right, so these equipment are very commonly used, to detect the basic health condition. All right, so let's start. The first equipment I want to introduce is the sphygmomanometer. Sphygmomanometer. Now this is a very long name. So this is the equipment to manually check your blood pressure. So normally nurses use this a lot. The sphygmomanometer to check a patient's blood pressure. Now, blood pressure has a short term called BP. And it has two readings. The number on the top is called the systolic blood pressure, and the number on the bottom is called the diastolic blood pressure. Right? The unit for blood pressure is millimeter mercury. So the normal range for the systolic blood pressure is between 90 to 130, and the normal range for diastolic blood pressure is between 60 to 90. Say if your blood pressure falls in this normal range, that means you have no issue with your blood pressure, so that's good. So for example, if your blood pressure is 110 over 70, that means it's normal because it is within this normal range. All right? Now, next equipment I want to teach you is the thermometer. Thermometer is the equipment used to check your temperature. Our normal body temperature should be between 36 to 37 Celsius degree. So if you have a temperature above 37.5, then it's called like a fever, especially if your temperature is above 38. Is a fever, right? If your temperature is below 36 or even below 35, that's called hypothermia. So it's a bit low. Especially if it's very low, it's called a hypothermia. All right. Now, thermometer. So thermal means heat. Meter means to measure. So think about how to remember this word. Thermal means heat. Meter means to measure. So thermometer means measure your body's heat. So that is to check your temperature, all right? And there are different sizes to check temperature. The most common size include oral in the mouth, axillary under the armpit, temporal in front of your forehead, and the tympanic inside your ear. So there are different types of thermometer that you can use to check temperature in different sizes, right? You can use a thermometer to check temperature in the mouth, and this is called oral thermometer. If you check temperature in the ear, this is called a tympanic thermometer. If you use this to check under the armpit, this is called a axillary site. So axillary is also called the professional name for the under the armpit. All right. And then if you check the thermometer also can, there's type of thermometer you can use to check temperature in front of the forehead. And so there's an artery called temporal artery here. So we use the thermometer to check the temperature in front of the forehead because it's close to this temporal artery. All right. So this is called the temporal thermometer. All right. So there are different types. Especially during COVID, during the COVID pandemic, we prefer to use the temporal thermometer because you put the thermometer in front of your forehead, so you don't touch your body, so so it will reduce the risk of infection. So the temporal thermometer is more commonly used during the pandemic. All right. Now, the next equipment I want to introduce is the stethoscope. So stethoscope is the equipment used commonly by doctor to listen to the sounds of your body parts. All right. For example, doctor can use the stethoscope to listen to your heart sounds, your heartbeat, your lung sounds, your bowel sounds, your abdominal sounds. So it can use to listen to the sound for your internal body organs. Yeah, so this is very commonly used. Yeah, if the sound is abnormal, then there could be something wrong with your health, and then it helps the doctor to make the diagnosis. All right, so this is called a stethoscope. Stethoscope is used to listen the sounds of different body parts. Now, the next one I want to introduce is a glucometer. Glucometer is the equipment commonly used to check a person's blood glucose level. Blood glucose level. Now, blood glucose is the sugar inside your blood. The sugar inside your blood. Now, we continuously need sugar to provide the body with energy, right? So we consume the food, and the food, different types of nutrients, and the nutrients will provide us with energy, and the nutrients will then be converted into sugar in the blood. So the sugar is also called the glucose in the blood, all right? Now, our normal blood glucose level should be between 4 to 8 millimole per liter. Yeah, 4 to 8 millimole per liter. So this is the random blood glucose level. So say if you want to check your blood glucose, you go to a clinic, or you get a doctor or nurse to check your blood glucose level. Doesn't matter you eat or not eat. Doesn't matter you have empty stomach or a full stomach. Your sugar level should be between 4 to 8 millimole per liter. But if you haven't eaten and you have an empty stomach, then your blood glucose level should be between 4 to 6 millimole per liter. So it should be less than 6. And this is called a fasting blood glucose level. So fasting means you're not eating, you have an empty stomach. So normally we do the fasting blood glucose level in the morning, and we don't eat breakfast. Yeah. Okay. Now, if your fasting blood glucose level is above 6.1, you have to pay a bit more attention, because that means you have a risk of getting high glucose level, right? Yeah, so you have to start to control your diet, to balance your diet and eat less sugary food or drink. All right. Okay. Now, so this is glucometer. Glucometer is equipment to check our blood glucose level, all right? If your blood glucose level is higher than normal level, it is called hyperglycemia. Hyperglycemia, all right? But if your blood glucose level is lower than the normal level, it is called hypoglycemia. Hypoglycemia. Yeah. Now, hyperglycemia. So hyper means above, gly means glucose. Cemia means inside the blood. Yeah, so hyperglycemia means the blood glucose level is higher than normal range inside your blood. All right? Yeah. Okay. Next one I want to introduce is a pulse oximeter. Pulse oximeter is a very small device that is applied on your finger to check your heart rate or pulse rate and the SpO2, the oxygen saturation. So oxygen saturation can tell you whether you have enough oxygen in your blood, and whether you need oxygen to be delivered. Okay, so this is called a pulse oximeter to check your heart rate and also to check your oxygen level inside your blood to see whether you have enough oxygen supply for your body. All right, and this is applied on your finger. Remember that. It's very easy to use. Now the next one is tourniquet. Tourniquet is a compression device that is commonly used by doctors and nurses to check a person's blood test. So remember, when you go to clinic to get your blood test done, now normally you can see the nurse put a put like a device wrap around your arm to make your arm tighten. Yeah, and then you feel quite tight, and then they will start to take the blood. So this device is called a tourniquet. Yeah, tourniquet. It's a compression device to give the pressure on your arm. So because when we apply the pressure on the arm, then the nurses could easily see your veins. Yeah, see your veins more clearly, and then they can find the vein, and then they can get the blood successfully. Right? So this is a compression device used for blood tests. So it helps to see your vein clearly. Also, the tourniquet can also be used to control the bleeding, because if you have a bleeding, the nurse could apply a dressing on the bleeding side, and then quickly apply this tourniquet to give continuous pressure on this bleeding area to control the bleeding. All right. So pressure is also called compression. When we have a bleeding, we have to immediately apply compression to the bleeding site to control the bleeding, stop the bleeding. Yeah. So this tourniquet can be used to also control the bleeding. So two purposes. One is to do the blood test, one is to control bleeding. All right. So these are the common equipment that are used by doctors and nurses to do a basic health check for your body. Thank you very much for listening. Hopefully now you understand a little bit better about these terminologies. Thank you.